Good evening, everyone. I hope everyone can hear me.
Yeah, we can hear you.
Yeah, thank you. So, thank you for everyone joining for today's webinar on how to conduct a bottleneck analysis and root cause analysis by our public health research fellows. This is the fifth weekly webinar series organized by FPHS, and we have two fellows for today's session, Dr. Amrita Barhati, Associate Professor from Symbiosis College for Women, Symbiosis International University, and Dr. Pentapati Shiva Santosh Kumar, a Senior Resident from Department of Community Medicine, AIMS Mangalagiri. For this session today, we are joined by our founder, Dr. Chandrakant Laharia, who is a leading public health expert and health policy specialist. Coming to the topic, bottleneck analysis and root cause analysis are two widely used tools in public health management to pinpoint the constraints of the program implementation and identify the causes of any adverse events or consequences. This webinar will be helpful in understanding how these analyses are conducted in implementation of the programs, especially public health programs. We look forward to the conversation ahead, but we will take all the questions towards the end. And this meeting is live on YouTube on the FPHS channel. So we also have external audiences who are watching this session live. And over to Dr. Laharia for initial remarks. Over to you, sir.
Thanks, Balaji, and hello, all of the fellows. It's always pleasure that I see so many of fellows, the same group of fellows appearing on this evening webinar. Though I could not attend a few, but I follow and ask with my team about who all are attending. Personally speaking, considering our team, Balaji, Anshika, and other team members make a lot of effort in planning and scheduling these webinars, I'm personally a bit disappointed that the participation is relatively low. We have 36 fellows, and entire program is designed to support, facilitate. So if fellows want to derive the benefit out of this program, and then the minimum requirement is participation in these webinars. These are once in a week, and of course some expert session. But if a fellow, in my opinion, is not able to devote even 2 hours of time for these webinars, which require a lot of effort on our end, and some fellow prepare PowerPoint slides. So it's a disrespectful to the fellow colleagues that your fellows are making presentation, but you do not appear. And if you are so busy, if some fellows are so busy, I think then there would be alternative rather than applying for fellowship. I think one of the message, Balaji and other colleagues, I want to communicate that the participation of fellows in these webinars is almost essential. This is not just any other program that whether you attend or not attend. So we discussed earlier that there are certain criteria. If any fellow does not meet those criteria, including if attendance is insufficient, they do not qualify to get a fellowship certificate. The fellowship will not be completed. So though we have discussed this within our team, and I never wanted to bring this in this forum, but I just want to lay down the rules that this fellowship program is for each of the fellows. So if they are not attending, it is not automatic that they would get a certificate at the end of the program. In fact, the program is structured in 2 blocks. Everything is done will be done twofold, like 2 manuscript, 2 other aspect, 2 workshops. Those things are in 2 blocks. So first block is January to March, and second block is April to June. So if someone is not able to do, like not started on manuscript, not doing any work in the first block, so time will pass by, but that does not mean you have completed that block. And in end of March, and please communicate to other fellows also, end of March, we will do an assessment that who has performed really well. And if some people have not attended at least 75 to 80% of webinar, if they are not worked on the manuscript, not contributed to the work, essentially an objective assessment, whether if they have not invested enough time in fellowship program, then their block 1 would be considered incomplete, and which essentially means they would not be eligible to get a fellowship certificate at the end of June. I'm not saying that they would be removed from the fellowship program, but then they might have to complete that block in the future. So the amount of effort need to be invested in 2 blocks is fixed. You cannot get away without doing that. Somebody cannot say that they will do everything in last 6 weeks or complete the program. No, it doesn't happen that way. In any college education program or school education program, you cannot say that you will not come to the college for 2.5 years and the last 6 months you will come take all the credit points or all the programs. So point I want to emphasize here that my participation is not important. Balaji's participation is not important, but participation of fellows is so absolute essential for this program. Please respect the fellowship program. You have committed to something, respect your commitment. If the fellows are not appearing for the program, that means they are not respecting the commitment they have made. By applying for fellowship, agreeing to the fellowship program, people have made a commitment, and it's so non-professional. Like this is a group of professional, not college students, school students, which need to be taught. So I think one of the lessons everyone need to learn, like if you are in job or professional work, if you do not appear on the work, it's absence from the work and it's non-professional. So by merely not appearing in the fellowship programs, mandatory program, not doing what has been agreed, fellows are showing themselves as a non-professional. It's a very strong message I want to give, that if due to any reason some fellow want to withdraw, that they cannot do, they do not want to continue, no problem, but please be professional. This is lessons. These are the professional lessons in the program rather than teaching. The teaching is secondary. Everything in the fellowship program, no matter you go to Johns Hopkins, Harvard, the fellows do, and the environment is made to achieve them a certain goal. If fellows are not appearing, they are not doing it, then it's their failure, and we will review the program. And it is possible that by end March, some blocks are not completed. Then everyone will move to second block, but certificate will not be issued, or they have to repeat that block. And this is what we want to do. You can revisit the previous or the first webinar, the slides which we have, that what are the asks. We can have a discussion with Sapna, Balaji, Twinkle, the other colleagues, and with me. So that's the first message. But this message, I also want to move to the next one. The one is that everyone, like across the program masters or public health program, other public health teaching program, everyone is taught the same content. This is curriculum-based programs. But then many people ask me, why in spite of same curriculum, same training, some people get good opportunity, others do not. So the reason is that, and one of the things we need to remember, that there is no value if everyone know the same stuff. So it is what additional value you carry to any organization that decides or determine your future job prospect and career prospect. And that's very important, is that as a fellow, as a public health person, you need to have good understanding of at least one area, one topic which you can say you know better than others. Now, those areas or those topics would come from outside the course, from outside the curriculum. And you have to identify. Nobody is going to tell you that you do this. People might tell you, but somebody who is listening from others, then there would be other guide or direction to many other people. So you select a topic which is unknown or lesser known, which is difficult to master. And if you work on those areas, you will get a distinct advantage. So today's session is about those topics which are so very important in international public health, which might be like, if you know those topics, you will stand out. So today's session is about root cause analysis. Like root cause analysis is an important approach, and we will hear from our fellow, but very few people understand it fully. Similarly, other topic is a bottleneck analysis. And if you do search on Google, on an international organization, they often look for a bottleneck analysis, other parts. Third is a political economy analysis or political economy. So these are the three topics which I had initially listed, that As a fellow, you should have a learning and understanding. And that's why we are organizing this webinar. Now, I want each of the fellow to know the topic. You should have a distinct advantage on topic which is under captured. And then two of the fellow have kindly agreed to deep dive into these areas. But this is a theoretical discussion. These are the aspects when once you learn, then keep learning, practice, do root cause analysis for a certain disease. Each one of you can do, or few of you can do what, write an article that how bottleneck analysis is done, apply some of the practical lessons. Similarly, political economy analysis, read about it. To start with, you have to read and at least know to speak about this topic. Better is that you apply next step and apply that root cause analysis, for example, in vaccine preventable diseases, certain diseases. So today's session is about topics which are important but not widely known. And they are so important for public health person that they should, each one of you need to read. Today's primer are coming from two of our fellows. So I thank those fellows. I really request that please optimally utilize this opportunity of fellowship program. And these are just indications. These are not the only three topics. Second message I want to give you, that select a topic which is uncommon but important and develop a good understanding of that topic. Work on that topic for 3 months, 6 months, a year. But let's just start a journey. These three topics, if and at least 3 or 4 or 5 of you pick up, work on that, write a joint manuscript. I think that will be a good start. You will stand out from rest of the public health people. Without further ado, I hand over again to Balaji to moderate the session. But please remember these two things which I've shared with you. This program is for your benefit. Our team, we have no external funding, no resources. We are utilizing our resources. And our team is working so hard. So please request your fellow colleagues to attend these sessions, contribute to these sessions. Thanks. Over to you, Balaji.
Thank you, sir. So we'll start the session now. We'll have our two speakers, Dr. Amrita and Dr. Santosh. So we'll go one by one. So first, Dr. Amrita, she's going to present on how to conduct a bottleneck analysis. Over to you, Dr. Amrita. Hope
Hello.
you can share the screen.
Yes.
Yeah.
Everybody can hear me?
Yes, we can hear you.
Yes, I have shared the screen. Is it visible?
Yes, we can see it.
Yeah. Today, I want to present regarding bottleneck analysis. Now, when we say hello?
Yes, we can hear you, ma'am.
So this is the overview of my presentation. That first of all, what do you mean by the term bottleneck? And what are the types of bottleneck, the reasons of the bottleneck, and how we can do the bottleneck analysis and its examples. Now, first thing is, what do you mean by bottleneck? The literal dictionary meaning of bottleneck is a narrow entrance or passage, just like the neck of a bottle has. However, when we use this term in terms of a task, the term bottleneck refers to all the challenges, hurdles, or obstacles in the task. So we can say that something which retards or halts the free movement or the progress of the task or work. So all the factors that constraints, for example, here there is example of service delivery. All the factors that constraints or there is an obstacle in that service delivery that we call as bottleneck. So a bottleneck is the point of a process where the flow is constrained and affecting the entire work. And we are going to, through the bottleneck analysis, we are going to analyze the reasons that obstruct the project or the planned activities or the work. So in turn, it reduces the progress of the work, the flow of the information, the flow of production, productivity, effectiveness and efficiency. So the bottleneck, this term is applied everywhere else, like not only in healthcare or health sector, but it can be applied in any kind of manufacturing, productivity, or technical field. So there are two types of bottleneck, basically. First is the short-term bottleneck and second is long-term bottleneck. Short-term bottleneck, it is a temporary hurdle or a temporary constraint in the flow or the progress of work. So for example, we can call as organizational hurdles that occur unexpectedly. So that is a temporary or a short-term bottleneck. For example, obstruction in the supply chain of any product or delayed release of a budget or a material resource, limited staff due to because of going on a vacation or a festival, limited manufacturing due to limited stock and reduced number of goods. Long-term bottleneck, these are the bottlenecks or hurdles that are regularly or reoccurring in a process of work or in a progress of work. It will remain for a longer period of time and it affects the production line and productivity of a project. For example, lack of appropriate technologies, limited fund and resources in any project, then disorganized working mechanism, lean manufacturing, that means a type of manufacturing where we have to give maximum output with minimizing the waste. There also long-term constraints or long-term bottlenecks are created. So as we have understood what is a bottleneck, let us find out what are the major reasons for these hurdles or constraints. So bottlenecks, these are the challenges or obstacles which are in a work. These are mainly because of three things. First is the people or the human resource. For example, when there are limited number of staff working, lack of capacity building or inadequate training of people. For example, inadequate training of people and health workers in any kind of health programs. Then second is system and technology related bottlenecks, lack of modern technologies or equipment. Now, in any kind of sector, if we have outdated technologies, so naturally we'll have slowing of the process, slowing of the flow of the work, or any ill-defined process. It will also cause a hurdle. There will be a delay in productivity. Third bottleneck is regarding organization. When there is a particular rule of procedures or law that this kind of process, it should be followed in this particular way. And if it is not followed in that standard operating procedures, then also it can cause a delay or obstacle in the flow of the work. Or if there is a poor leadership, lack of effective monitoring and evaluation of that project or program or mechanism, and if there is a lack of staff appraisal or poor forecasting. Now, when we talk of bottleneck analysis, particularly in terms of programs and projects, it is a process where the bottleneck of any program or projects or organization, it is assessed and evaluated. Now, as we have understood what is bottleneck, these are the hurdles and constraints. We'll take it in terms of examples and how we are going to analyze and we are going to evaluate where are the bottlenecks and how we can eliminate these bottlenecks. A bottleneck analysis, it is a detailed process of analysis where an organization, it gathers all the data on the flow of the products or the flow of the process, especially where the work is bottlenecking or where the work is being obstructed. So it provides a deeper insight into why certain things don't work. Bottleneck analysis, it is essential to ensure effective coverage and efficiency of a program at the community levels. So the common examples of bottleneck in project planning and implementation is limited resources, may be it human, financial, or material, absence of limited technology, limited geographical coverage of that program, irregularity in utilization of services by the beneficiaries, insufficient community participation, absence of harmonized supply chain of any products or we can say drugs, lack of trust and harmony between the project implementers and the beneficiaries, and lack of effective and efficient service delivery mechanism. So what is bottleneck analysis? That was regarding what are the major reasons of bottlenecks in health sector, project planning and implementation. Now let us see what is the bottleneck analysis in health sector. Bottleneck analysis in health sector means identifying the barriers for effective and efficient health service delivery. So these barriers or obstacles, These may be physical barriers, social barriers, or economic barriers that hinder the smooth implementation of health programs and projects. So here in bottleneck analysis, the most important or commonly used is Tanahashi model, which is widely used to identify the bottlenecks in the health system. This Tanahashi model is a graphical display of 6 health systems factors which interact to influence the effective coverage of. They have given the child survival indicators as an example. So this is the Tanahashi model, which is very commonly used to identify the bottlenecks in the health sector. Here in this Tanahashi model, they have taken childhood illness, that is in IMNCI, that is integrated management of childhood illnesses. What are the bottlenecks in the implementation of that program? So first is the stock of antibiotics in the district. It is 60%. Then percentage of health workers trained in IMNCI, it is around 57 to 58%. But the percentage of target group within 5 kilometers of that healthcare facility, these are only 40%. So this is the first bottleneck, that very few beneficiaries can use that service. Second major bottleneck in this model we can see is child with acute respiratory tract infections, which is seen by a trained health worker, it is around 38%. And child given antibiotics, it is around 35%. But the children which completely utilize the antibiotics, or they complete the full course of antibiotics, that is very, very less. So that is the second bottleneck. So in this Tanahashi model, if we present the data of the services in a program, we can identify the bottleneck. Here again, in the same Tanahashi model, proportion of health facilities with stock of ORS and zinc, it is 50%, but the proportion of facilities with healthcare workers who are trained to give those ORS powder and zinc, these are 0%. This is the first bottleneck. And second is utilization by the beneficiaries. So that is demand side bottleneck. So one is supply side and the other is demand side. Now, how to identify these bottlenecks? There are two different ways in identifying the bottlenecks in any given program, project, or sector. First is identifying the place and root causes of bottleneck. So mainly two things. Where is the hurdle or constraint, that is the bottleneck, and what are the root causes? The first thing is we have to find out the place of that hurdle or obstacle. So the simple technique that we can use for this is 3-step. First of all, in any program or in any work you are analyzing, we have to map all the activities and the resources utilized in that program, keeping the track of all the work and its progress. We have to see that all this mapping of the activities and resources which we have done, we have to also track out the work and its progress and assess the time consumed at each stage of work. So where at what stage a longer time is taken, that is the place for our bottleneck. Second is, after finding out the place of the bottleneck, what are the root causes of this hurdle or constraint? After identifying the possible place, what we have to do is, we have to identify the root causes by, for example, in terms of health programs or projects, we have to take into consideration the qualitative in-depth interviews with the key informants. Now, in any implementation of health program, the key informants will be the community leaders of that area, local community leaders, or the key informants will be the residents or the residents of that particular place. Then we can use qualitative in-depth interviews, focus group discussions, and from them we can analyze why they are not able to use that service, and also with the help with focus group discussions of the health workers with the beneficiaries, we can identify what are the root causes from the demand side and also from the providing side, that is the health workers, service delivers. There is also one method besides the key informant interviews and focus group discussions. It is the fishbone method or fishbone diagram. Here, for identifying the causes, like the fishbone diagram, we can chalk out, that is, what is the human resource problem, what is the material problem, the equipments, where is the delay in the process, and then we can identify the problems. There is one more technique, just like fishbone technique and the interviews, the 5 why technique. 5 why technique means asking a minimum of 5 why questions to find out the root cause of the constraints or the bottlenecks. Now, this 5 why technique, here I have given an example. When a problem occurs, you drill down to its root cause by asking why 5 times, and then you get a countermeasure becomes apparent. The first is my general example I have given here. For example, when service delivery or goods delivery, here we are delivering the leaflets. Now the client is refusing to take the leaflets that is printed. So why they are refusing? Because the delivery was late and the leaflets could not be used. Now again, the second why is why there was late. They were late in giving the delivery because the job took longer than they expected. Now why the job took longer? Because they ran out the printer ink. Again, why they ran out for the printer ink? The ink was all used for a last moment order. And again, why they didn't have sufficient stock? Because their regular supplier, they couldn't procure extra ink, printer ink from the regular supplier. So the countermeasure, after analyzing with the help of 5 why technique, is to find an ink supplier who can deliver at a short notice or at the last moment. Now here is the second example of 5 why technique, where for example, in our health sector or in a hospital, the patient was late to come in the theater for the operation. And why there was a delay? Because the patient could not find a trolley. Then why he couldn't find a trolley? Because there was a replacement trolley was not available. Why it was not available? Because it was worn out and eventually broken. And finally we get the root cause, that a regular checkup of the wear and tear of the trolleys and the equipments, it has not been done. That is the root cause, or that is the bottleneck. There is one more 9-step process to identify the bottlenecks. Is you have to create a flow chart of all the steps in a program from start to finish, and we have to find out the average time and efficiency for each of the process. We have to create a visual representation of all the flow of the process, right from the start till the finish. And then we have to discuss with the team members of the project or the concerned stakeholders, service providers, about the expected and the ideal effectiveness and efficiency of operation or work at each step. We have to compare that flow chart with the expected work performance, and then we have to identify the bottlenecks, that at which stage we are getting the bottlenecks. Now, in case of health program or health project, who will identify this bottlenecks is program planner and the designer, the persons who are going to implement the program, the concerned stakeholders, supervisors, the program evaluators, and sometimes we can take into consideration the beneficiaries also. We can get some inputs from the beneficiaries as well. Now, this is one more example which I have taken from an article using bottleneck analysis to examine the implementation of standard precautions in hospitals. So this is an article where in PubMed, where they have analyzed through the bottleneck analysis, that is, what is the probable reason that all the healthcare workers in a hospital, in 12 hospitals they have evaluated, they are not following the standard precautionary measures for example, personal protective equipments like hand sanitizers, use of gloves, or use of masks. And then they found out through the bottleneck analysis that mainly the first bottleneck, the main reason or the main bottleneck was improper use of personal protective equipment was a primary bottleneck. And the reasons of this improper use of personal protective equipment by the health workers or the doctors in those hospitals, it was because of high workload, time constraints. They had some misconceptions that after wearing the gloves and the mask, it was interfering with their clinical judgment, and these were their sub bottlenecks for their primary improper use of personal protective equipments. So after understanding what is a bottleneck, where we can find the bottlenecks, the types of bottlenecks, and the bottleneck analysis through Tanashi model or 5i technique or fishbone diagram, let us see what are the advantages of this bottleneck analysis. Now, bottleneck analysis, it is very useful, first of all, to eliminate all the hurdles and obstacles in the flow of the work or the process. Second thing, we can collect all the quantitative and qualitative data for efficient service delivery. Third, it can increase the work efficiency and productivity naturally, because the flow of the work and the progress, it remains unhampered after identifying the bottlenecks. Then we can use maximum utilization of local resources. We can prevent the reoccurring of the long-term bottlenecks. It can enhance the performance of the staff, because after identifying the bottlenecks through bottleneck analysis, when the work process or the workflow, it is streamlined, naturally it will create an environment for the staff, better environment for the staff, and then the staff can perform at its maximum productivity, and it will maximize the program output, and it will help to eliminate or reduce the waste, because many a times through when there is a lot of bottlenecks or lot of hurdles in any flow of work or process or a program, it will cause insufficient processes and it will generate a lot of waste. And the last and the least is the bottleneck analysis. It helps to improve the knowledge regarding the work process. Thank you. Hello.
Yes, ma'am. Hello.
Hello.
Am I audible?
Yes.
May I ask one question, please?
Yes.
Do you have any tool to or any software to do the bottleneck analysis, ma'am?
I didn't when I searched, I didn't come across. I don't have an answer to this, because I searched for, but I didn't find a tool.
Okay. Okay.
Yes,
Because
Dr.
otherwise
Mohan
it
Kumar.
becomes very subjective kind of a thing.
Yes.
Otherwise it becomes a very subjective kind of a thing.
Yes, so like objectively, if we have a tool to analyze, that's your concern.
Yeah, because it is subjective. For me, I feel a different perspective. I would have a different perspective, and other person would have a different perspective in analyzing the hurdles.
Okay.
Well, if I can come quickly here.
Yes, sir.
Yes, sir.
The point is that this is a qualitative approach to find a operational solution or practical solution to a problem. Now, this is done based upon a certain tool which you devise. Now, to develop that tool beforehand, you have to identify the problem statement. Once you identify the problem statement, you define the objective of your bottleneck analysis. And once objectives are identified, then a group of people who understand the process and context will develop a tool, qualitative tool, which will answer the question for which you are looking for the answer. So it is one of the two approach. There cannot be defined tool. You need to ask question to search for the answers, and this is done through the predefined tool, which is agreed among us, the researcher. So it follow a certain principle, but it is not like a quantitative component. Of course, the quantitative, it need to be supplemented by quantitative data, some ground information, but this is more of a mixed method of qualitative research approach, which is followed. So no standard tool, like for the, depending upon situation, you have to devise or develop the tool. But I would also suggest that this is exactly the kind of discussion I want the group to have. The idea of this, when you ask question, you look for the answer, you get the answer and you remember it for a longer period. So it's not necessary, like it was a really good presentation.
Thank
And
you,
it's
sir.
not necessary that we need to have answer for all the question in one go. That's where the power of group is. Like I want other fellow men to answer that question, chip in. So Mohan is raising hand, I believe. So let's go to Mohan.
Thank you, sir. Ma'am, it was a very good presentation. I have a doubt, like removing the term bottleneck analysis from the discussion now, the concept of bottleneck analysis is more similar to implementation research. Like when we say, for example, when we start a program, we start implementing it, we find the hurdles and then we improve on it. So this is how the implementation research also goes.
Yes.
So if we remove the terminologies out of it, are both the same? Like implementation research and bottleneck analysis are the same?
Frankly speaking, I have not read much on implementation research. So
I think that could be topic for next. No, both are not the same. Implementation research essentially means those research do not follow a very rigorous scientific process, but any research which intends to find solution to a programmatic challenge is called implementation research. Because in those research, you are not adding value to the academic knowledge, but more so to find a solution. Okay, this program is not working. Women are still anemic in spite of anemia, like in spite of various programs going on. What are the reasons that women do not consume iron folic acid tablets? So finding those kind of operational answer to the operational challenges is implementation research. So bottleneck analysis could be one of the component, but I request, since this question is coming, that for next maybe 2 weeks later, someone select the topic and let's present what is implementation research. And once we have a fellow volunteer, we will find someone, some expert who will chip in and all will also join.
yes, sir.
Yes.
So,
Thank you,
I
Dr.
have a
Amrita and
question.
Mohan Kumar. Yes, Swati, we can go ahead.
I just want to ask my question by giving a scenario. Like if we are doing a study on the healthcare workers, especially if we are taking A&M, and we want to get an idea that how much they are working for, how much, I mean, this is just like a time motion study. And if we are evaluating that, how do they give, how much time they are giving for their work, especially like if we are documenting multiple data if you're documenting single data in the multiple registers, or if they are far from their PHCs and they are having a lot, they are much taking their time and traveling, then if we are getting the result in a percentage way, then we can directly jump into the most common reason of their efficiency is getting lower, is like that with if we are taking a root cause analysis.
Yes, then that time their traveling time is more. So that is the main hurdle or bottleneck.
But ma'am, actually my point is just if we are getting a percentage in various reasons or in their works, then we can directly jump into the reason for the most common reason of
the most common reason is the primary bottleneck and the other are secondary bottlenecks.
Okay, right. With only the percentage we can get into like because this is subjective and it is more a qualitative.
Yes.
So with the only this part quantitative, we can write our answers also, like write in discussion also.
Yes. Yeah.
Okay, ma'am. Thank you.
The key point is that this you can say, okay, what is the bottleneck in this particular A&M or certain context? But when we do bottleneck analysis, we are approaching the problem from different perspectives, health systems perspective. And in bottleneck analysis, you would look at multiple angles: A&M, medical officer, overall health services, vaccine supply. So the scope of bottleneck analysis is or approach of bottleneck analysis is from health system perspective much broader. The example which is there is one component. So both are bottleneck analysis, but bottleneck analysis has a broader meaning. But the point to remember is that our approach should be more of what we are looking for. Your question or methods or what approach you follow depends upon what is the problem you want to solve.
Okay, sir. Right.
I hope Swati's query got answered. So I can see Prabkirat is raising her hands, so we can hear from Prabkiran.
Yeah, hi everyone. Just a note, I just feel that bottleneck analysis doesn't have to be necessarily qualitative. For example, if you look at the Tanahashi model, and if you consider, let's say, if you want to look at A&Ms and the subcenters, and you want to figure out what the bottlenecks are, you can always create a qualitative model, a flowchart of sorts, create quantitative indicators to highlight the processes, and they then maybe like do a bottleneck analysis using the Tanahashi model for like really conclusive results. So, I mean, please correct me if I'm wrong. Just thinking out loud.
Yes, qualitatively, you're identifying the root causes and then you're calculating, just like the Tanahashi model, the
Yeah.
percentages of that hurdles or constraints.
Yeah, percentages, or I mean, percentages, or any indicator that remains constant
Yes.
in all the processes. Yeah, that's all.
I have one suggestion here, that whenever you are having this presentation, I strongly recommend that 2, 3, or 4 of you, without our intervention, amongst yourself, form a team and write about these aspects. For example, bottleneck analysis presentation, like the person who has taken lead in the presentation can work together, collaborate with each other. It's your role, Dr. Amrita, that
Yes.
write a short piece. It may be published. Even if it's not published, you will practice those skills.
Yes.
So I strongly recommend that write a short commentary or short CME article on bottleneck analysis. Select fellow colleagues who you think could be useful, or the one who are willing to volunteer and would actually contribute. So please follow this approach, and for each of the presentation, at least attempt. It should not end when you finish the presentation. So that's my strong plea to each one of you. Thank you.
Yes,
Sir.
Thank you, sir. Yes, Dr. Rishabh.
Yeah, I first wanted to thanks Madam for the wonderful presentation on this topic.
Thank
and may I be cheeky and say that why not let's work on this bottleneck analysis about the low number of participants in this fellowship program. That will be sort of a real life solution. And we can we can apply the things which we just worked, we just saw, and we can even write that thing. So I think that will be an interesting thing to be innovative and prepare a ready-made solution for the problems which we are facing. This is my suggestion.
Hello.
Hello. Yeah. I hope sorry, I couldn't hear. There was a technical issue with my lab. So Rishabh Rana sir, can you come once again?
Yeah, what I was saying, that can we not prepare a short article, as sir was saying? First of all, a wonderful presentation. Thanks, ma'am. Thanks, ma'am, for this presentation. And then why can't we just use the things which we learned in the PPT to do a sort of a bottleneck analysis of this problem which we are facing in this program, like the low number of people turning up for the presentation. So
yes, we can identify the causes.
Yeah.
Sure, we can come up with that, and I think Dr. Amrita can take a lead over that, and she can collaborate with 2 or 3 fellows, and you can always come up with such ideas, and you're always free to discuss also, and you can share it with us. That's a nice idea. Thank you, Dr. Rishabh, and I hope you can collaborate with 2, 3. I think fellows can volunteer themselves and they can work on this aspect. Sure. And thank you also, Prabkirat, for adding a different insight and perspective, and that was very useful. So with a time bandwidth, we'll just move to the next presentation, or the second presentation of the day. How to Conduct a Root Cause Analysis by Dr. Pentapati Sivasantosh Kurma. He's a senior resident, Department of Community Medicine from AIMS Mangalagiri. And over to you, Dr. Santosh.
Thank you, Mr. Balaji. I hope my
Yeah.
voice is clear.
Yes, your voice is clear. You can go.
Thank you. Thank you. Good evening, all. Good evening, Chandrakant Laharia, sir. So today I'll be talking a bit about root cause analysis. And first of all, I should thank Dr. Amrita ma'am, because she had covered most of the part, mainly the tools related to root cause analysis and all in her presentation. But now I'll focus mainly on the basics about root cause analysis. So before going to the presentation, I just want to give a history about this root cause analysis. Basically, this root cause analysis, even this bottleneck analysis, everything, like these are continuum parts. Like it's not like one is separate and another is separate. It's like continuum sort of. These things started. These things have not started in the healthcare part. These things started for business. So basically, the industries and mainly the business areas, like they have started this root cause analysis, starting like the histories. And even among us also, who are doing this managerial roles, administrative roles, and also who are mainly into quality area, and who like prepare documents for the audits and all, they'll be knowing about this root cause analysis. So this root cause analysis started with something called as safety-based root cause analysis. Like if some safety-related accidents happen in some industries and all, why it has happened, how it has happened. So in that way it started. And then it went to production-based root cause analysis. Means if there is some problem in the production or something related to that, then it gradually evolved. So it's sort of version 2.0 for the safety, for the root cause analysis. And then it went to process-based root cause analysis, and then failure-based root cause analysis, and finally systems-based root cause analysis. So the one which we are talking is mainly system-based root cause analysis. Even the example which I'm going to give is also type of system-based root cause analysis. It's like it's the highest version, like 5G for mobiles or ChatGPT for current AI. So it's amalgamation of all the above, which I told you. So now we'll go into the presentation. I'm not able to change the slide. Just a minute. Yeah. So this root cause analysis, like what I feel is most of us might have done in our life. Like I don't want to pertain this root cause analysis only to the professional life. In our personal life, we might have thought, we might have done this root cause analysis, but we might not have known that it's root cause analysis. So I'll tell that also example later. So root cause analysis is a class of problem solving methods aimed at identifying the root causes of problems or events. That means it's a system to find the real causes. And those real causes, if we can do some action on these real causes, we can prevent these problems happening in the future. So those utmost important and the real causes, that is the thing which we are finding with this root cause analysis. Root cause analysis is based on the belief that problems are best solved by attempting to correct or eliminate the root cause, as opposed to merely addressing the immediately obvious symptoms. I'll show you the next slide, from which we will get some clarity about this point. So this is a very common picture when it comes to root cause analysis. So you all might be knowing the trees, plants, and everything. So what we see above the ground might be very small. Which is beneath the ground might be very large. So even in the real life, whether it's professional things, personal things, or whether it is health system or some other thing, so what we'll be seeing is only the symptoms of the real problem. It might be like mortality in a hospital, or it can be like percentage of medical students passing out. Among all, how many percent students are passing the exam, whatever it is. So these are just symptoms. So underlying root cause, it can be many things, and that is the systemic thing. Like if we can focus our, if the system, health system, or whatever the system is, if they are able to focus on what is below the surface and what is the real root cause, then the weed or the weed plant or the symptom will not come again. It's not just removing those branches of the weed. So what are the general process for performing a root cause analysis? First thing is, we should define the problem. Define the problem doesn't mean defining the symptoms. Defining the problem means what is the real problem. So most of our work in the root cause analysis will focus or will be totally dedicated to defining the problem, starting. Even many of the tools, in some other articles, what I read is there is something called as PDCA, plan, do, check, and act. So this plan part is something called as defining the problem. So most of the tools which we use for root cause analysis will be helpful here, like fishbone diagram or 5 whys or Pareto charts, etc. All these steps also, they are sort of interconnected. It's not distinct to each other. And then gather the data or evidence. So as I already told you, root cause analysis is something which is done systematically. It's not just something which can be done just like that. So if you want to do it something systematically, there should be an evidence or there should be data to tell that, yeah, because of this might have happened. So gather the data or evidence. Then identify issues that contributed to the problem. So this identifying the issues is like for this also we'll be using some techniques like 5 why technique or fishbone technique. So we'll be identifying what are the causes or what are the real reasons. We'll be asking why. It's an iterative process. Keep on asking. Asking means it doesn't mean I'm not saying one person. I'm saying the team which is performing the root cause analysis. I'll tell you clearly about that once we come to the example. Find the root causes. Once you do this iterative process, once you ask this brainstorming, and once you ask this why many times, then finally you will come with root causes and identify which causes to remove or change to prevent repeating the problem. You might be finding root causes which are multiple, but some root causes, like for some root causes, you can do something and you can change the thing and you can make sure that problem is not repeated. Those are like most important root causes. Develop solution recommendations that effectively prevent repeating the problem. So our work doesn't end at just knowing the problems or knowing the root causes. The next thing, corrective action. So that corrective action should also be done, and for that corrective action, we should develop the solutions also. Observe the recommended solutions or changes to ensure effectiveness of eliminating the problem. So once you do some corrective action, we have to do the observation also. As I told you previously, there is some cycle called as PDCA cycle. Plan, do, check, act. So that's what we are doing in the root cause analysis. So now I'll tell you an example. I think with this example, we'll get some clarity about root cause analysis. So what happened is in 2008, there was an outbreak which happened in Colorado, and the outbreak happened in something called as Alamosa County and Alamosa City in that county. So the outbreak is a severe GI illness has happened to some of the populations in that city, Alamosa City. When that outbreak has happened, immediately the team has moved, the emergency preparedness team has moved, and the healthcare team has moved. And the teams which has moved are Alamosa County Nursing Care Team, Alamosa County Emergency Preparedness Team and Public Welfare Department of Alamosa City immediately came into action, and they have done like the best of their efforts. And finally, like within 5 days, they were able to identify the organism for the outbreak, and they identified it as Salmonella certifi. And that's an organism, that's a bacteria, Salmonella. Okay. And in 12 days, they identified the source of the outbreak as contamination of public water system. So after, as usual, after any outbreak, they have nicely given a detailed report with some future recommendations. And the report obviously will be like given by the Public Health Department, and the Colorado Public Health Department has published that report. So this all happened in 2008. Then some investigators or some people of Harvard School of Public Health, they were going through these outbreaks and all. And then one person felt like, why this 12 days delay happened to find the source? Because 12 days delay is not a small thing. And because of this 12 days delay, around, like if they had find it out very early, like within 5 days, like when they found out the Salmonella certifi, that many people might not have affected. But because of this 12-day delay, multiple people got affected because of this outbreak. So this guy, like he's an enthusiastic researcher. So he's a PhD student at that time also. So this guy like went through these things, and in 2013 this happened. So and then he somehow like managed to like he felt like doing this root cause analysis. So he talked to his supervisor, and he talked to remaining people, and finally like everything came into action, and they sat for doing the root cause analysis. So who all have sat for
Hello, Dr. Santosh. I can't hear you.
Yeah, same. Cannot hear him.
There is some technical thing. Dr. Santosh, can you hear me? Hello, Dr. Santosh. I think there is some technical issue with Dr. Santosh's connection, so he will rejoin, I guess. So please hold for a while. Hello, everyone. I think there is some electricity issue with Dr. Santosh, so his internet got shut down, but he's joining through some other source, so he will join in a few minutes.
I'm very sorry, my electricity got disconnected, and because of that, my internet also had
No problem, Dr. Santosh. Yeah, we can continue.
Again, problem happened with this. Just a minute, I'll share it again.
Yeah, we can see.
Okay. So, so in 2013, it went to the next slide. I'll try to go to the before slide, but I'm not getting. Okay. So in 2013, they all sat together for this root cause analysis, and what the Harvard team has done is they made sure the main people who are part of that outbreak investigation were also there in the people team who are doing the root cause analysis, and along with them, they made sure public health experts related to those aspects from other areas also to be part of the root cause analysis team. So, and then they have moderated it. So then they started digging down, why this delay has happened. So then the people who were there at that outbreak time, they told their respective versions, and then the experts who are present from other areas, they also added from their things maybe this should have done, so the delay would not have happened, and etc. etc. So they have done the root cause analysis in that way. It's a sort of brainstorming root cause analysis. So what they found is, as I told you, this is Alamosa City in Alamosa County in Colorado. So this public welfare department of Alamosa City and Alamosa County, they are working independently. Whatever information which is known to Alamosa City Public Welfare Department, it is not transferred to the Alamosa County Public Welfare Department. So there is a gap in the information between both of them. So that is first important thing which they came to know. Next important thing, basically disinfection is something which is very important if the water supply is from the government side, and they'll make sure that water is disinfected before sending it to the houses, domestic purposes. What happened in this Alamosa City area is, the water from this Alamosa City area, it is coming from something called as artisan wells. It's a type of water source. So these artisan wells, generally there is a thing no need of disinfection of the water which is coming from artisan wells. So this Alamosa City people, Alamosa City Public Welfare Department, they got proper permission from US saying that no disinfection is needed for the public water supply which is happening through this Alamosa City. Certificate or that from the authorities, they got it around in 1980s, 1990s. So from then onwards, they are not doing any disinfection, any chlorination. They are just supplying the water. That is second most important thing which came into light. Then the third most important thing which came into the light is this water supply which is happening. The source is artisan wells for this water supply, but the distribution system which is there, it got compromised some years before the outbreak has happened, and this information is there with the Alamosa City Public Welfare Department, but this information is not there with the Alamosa County Public Welfare Department. So one is disinfection is not needed for the water, and that certificate they got it, they already have it. And second thing is, though the disinfection is not needed, distribution system is compromised. So these two informations are already there with Alamosa City Public Welfare Department, but not with the Alamosa County Public Welfare Department. So these are something very important things which happened, which came into light because of this root cause analysis. Then the third thing which came into light in this root cause analysis is the outbreak investigation team, which had taken part in this outbreak investigation. They are mostly doctors, nurses, and emergency team. Okay, but there is no person related to environment in that team. So what happened is, when this outbreak had happened, this team focused only on management or only on control aspect. They did not focus anything on prevention aspect, or they did not think anything related to environment, but they have used their sources only for managing the patients. That's why In the previous slide, I clearly told you the Alamosa County nursing team has come. It's not Alamosa County public health team, total public health team. Okay. And emergency preparedness team has come. So these three important things came into light because of this root cause analysis. So now they made this root cause analysis, this diagram, this beautiful diagram. So above they have given the story arc, like what had happened, like what is the thing which had happened and all. And then they started with the objective. The objective is to identify the source of pathogen causing severe GI illness in order to control the outbreak and limit the new number of new cases. Then for this objective, the response challenges. The response challenges are identify source of the pathogen causing severe illness. Then they got the immediate causes. That is salmonella not commonly found in the public water supply. Yeah, this is one more important thing which I forgot to tell you. Yeah. So on the 5th day, when they came to know that when the information came into the light that salmonella is the one which is causing the outbreak, they thought this might have happened because of some outside food places, but not because of the public water supply. Like US has a good public water supply, so they did not focus much on this public water supply. So that is something which happened. And another immediate cause is public works knew there was a break in the unchlorinated supply, but public health officials did not. Means what they want to say is the public work department of Alamosa city, they did not reveal the information related to this no need of disinfection and there is a breach in the distribution system. They did not reveal that to anyone. Okay, even their own public health officials also. What are the main contributing factors for these immediate causes? Main contributing factors is city runs the water system, but county health department was responding to the outbreak. As I told you, the responding team is county team for health related thing, but public welfare team is from city. Okay, and then second thing is public health department did not have an environmental health component. Means in the team which came to that rescue or which came to that outbreak investigation, they did not have any environment related expert. And the third thing is city and county did not have a good history of working together. Like as I told you previously, this public works department of the city and public works department of the county, they are totally independent. They don't have any good communication between them. So what is the lessons for improvement from this? Water supply must be chlorinated to prevent outbreak. So they have come with these solutions. The city and county must communicate to conduct outbreak investigations successfully. Public works need to develop an ongoing relationship with the public health and emergency operations. So they have given these lessons and they have published this paper, and later on, like they made sure that these things does not repeat. And one great important thing which I want to focus here, or which I want to tell here, is this total root cause analysis thing happened in 2013, and the paper got published and they have written the paper in 2018. 2008 outbreak happened. 2013 this root cause analysis they have done, and 2018 they have written the paper. Generally, if something like if we do some study and if we don't publish the study for 4 or 5 years, there are very less chances to getting published in a good journal. But this got published in a very good journal. Okay, and in the recent session by Chandrakant Laharia sir also told the same thing. Like someone has asked about like can we publish the data which is 4 or 5 years old? So sir told answer to that. So this is a great work. That's why it got published even after 5 years. Balaji, can you share the slides, because I'm not able to move the slides from here.
Okay, fine. Just wait a second.
Yeah, please stop sharing. from 7th slide, Balaji. Yeah.
I hope
So-
everyone can see the screen. It's fine, right?
Yeah, it's fine. I can see the screen. Yeah, someone also
Yes.
responded.
Yes.
Yes. Yeah, thank you. So what I told you previously, that one is only called as cause mapping of root cause analysis. So in this cause mapping, root refers to cause beneath the surface. It is the system of causes that shows all the options for solutions. Means that is the main causes for the problem. Do not focus on a single cause, as this can limit the solution set, resulting in missing a solution. So when we are doing the root cause analysis, it's always the patience which is pretty much needed for all the team members. So we should not come to just one single cause or some single thing that this is the main cause or this is the cause. We should see for the set of causes. A cause map provides a simple visual look at all the elements that produced the problem. The previous slide which I showed you, that is called as cause map, which will give you a it's a visual thing for showing the work which you have done and for the solutions, for the causes, everything. Next slide, Balaji. Next slide, Balaji. Yeah. So cause map. So cause mapping contains 3 steps. Define what is the problem. As I told you, the main problem which is there, and then analyze. We have to see why that problem has happened. We have to find the causes with the help of brainstorming or 5 whys or fishbone, taking help of multiple experts, all these things. Analyze, and then prevent. Prevent is solutions. What solutions can be done? So these 3 things should be there in that cause mapping or cause map, which we draw from it. Next slide. Yeah. So these are the most common tools which is used in root cause analysis: brainstorming, fishbone diagram, which already ma'am has told, Pareto chart. Pareto chart is nothing but it's a combination of bar chart along with cumulative frequency ke liye one curve, and remaining things like scatter diagram, flow chart, run chart, histogram, etc., etc. Next slide, please. Summary. So root cause analysis is a method to focus our efforts on the true root cause of problems so that we can truly prevent their reoccurrence. And one important, most important thing is, like the second sentence in this summary, like I feel like it can be applicable to our personal life also. Whenever the problem comes, we'll try to blame that problem on the situations, but we will not take that problem as an opportunity to really identify the problem, to really identify the cause, and to focus on the cause and to remove the cause with the solution. So that's what it is saying. Each problem is an opportunity. It contains the information needed to eliminate the problem. But to identify the root cause, we have to ask why over and over until we reach it. So this is the summary of the total presentation. So first I told you, like, it can be related to our personal life also, not only like this root cause analysis we can do for personal life also. Like I'll tell you an example, my own example. I had completed my MBBS in 2014, and then I have multiple aspirations, and I felt like I should do my MD in Delhi AIIMS. And then some of my seniors, I came to know that there is something called as Delhi DAMS, which is a very good institute, and whoever goes there, like, will get the ranks because all the higher ranks are from DAMS Delhi. So I went there, and I spent a lot of money, and coaching is done. And then I came back to my hometown, and I studied for November session. And finally, November session, I got such a rank, which is more than my May session, which I had given immediately after MBBS. Then I was totally like frustrated, and totally like I felt in a very bad way. Then first thing which came to my mind is, I'll share the papers, like next it will come in the this references also. So the next thing which I came to mind is, like, I first blamed the situation. I blamed that my mother got ill, and I was like, most of my time went there only. I could not focus much, and all these things. Then after some time, like when I regained my senses, I really root cause analysis. That time I did not know that it is root cause analysis. I have just done the analysis, like, which is a real important cause, which is not making me get the rank. Then I came to know what my root cause is, and then I focused on that. And in the next session, I got into AIMS. So like this is, mine is not a great example, but what I want to convey is this root cause analysis is not just only for health systems or only for industries or only for audits and all. You can do this root cause analysis in your own life, or you can do this root cause analysis in whatever problems which are happening in your field, in your areas, etc. So I think with this I will conclude. And next slide once. Yeah, references, and thank you. Any queries? Thank you.
Thank you, Dr. Santosh Kumar. So it was a very nice presentation, and also Dr. Amrita. It was a very great presentation. So 1 second, I'll stop sharing. Yes. So we can take, if any questions are there, we can take for next 5 minutes. And sorry that Laharia sir has left in the middle, like he had one more meeting. So he couldn't continue for the full presentation, but yeah, we can take 1 or 2 questions meanwhile, or if any question is unanswered or something, we can take a note of it and we can mail it to everyone. So any questions?
Thank you, Amrita ma'am. Thank you so much. Dear Dr. Swati, I'll share the published paper, the paper which I have shown in the presentation. That's a great paper. And one more thing is like one more paper is there, like it told about from basics or from history of the root cause till that steps everything. So that also I will share, which I kept in both the things in my references.
Okay, thank you, sir.
Yeah, sure. Thank you, Dr. Alok. Yeah, sure, Dr. Varsha. I'll definitely share the things.
Yeah, sure. Even I request both Dr. Santosh and Dr. Amrita to share the presentations in the group directly, so that our fellows can utilize it for their references.
Yes.
Sure. Thank you, Dr. Varsha. Thank you.
So if there is no query, so can we close the session?
First of all, I want to say sorry because my system went off, my electricity went off,
No,
and a
that's
phone call came. I'm sorry about
that's
all these
fine.
things.
That's fine, Dr. Santosh. That's fine. No problem.
Thank you. Thank
So,
you, Mihira, for thank you.
So before going to or concluding the session, I would also like to do an important announcement that FPHS is conducting expert talk series, and I hope you all people are aware of it. And this is also for our YouTube audience, that there is a session tomorrow on how community medicine department in medical colleges can deliver primary healthcare services. So it is do join the conversation on the same by Dr. B. Ramakrishna Gaud, professor from St. John's Medical Colleges and Hospital. The session will be chaired by Dr. Subodh S. Gupta, who is a professor and also head of the Mahatma Gandhi Institute of Medicine and Sevagram. And the event will be moderated by the founder of FPHS, Dr. Chandrakant Laharia. So it is on 18th February 2023, Saturday, from 11 a.m. to 12 noon. Moving ahead, we would also like to thank all our participants, fellows, also our YouTube viewers, and our speakers of the day, Dr. Amrita and Dr. Siva Santosh Kumar. Also, we would like to extend our gratitude to Dr. Laharia. I would also thank FPHS team for planning and organizing this webinar. And thank you, everyone. Have a happy weekend.
Thank you.
Thank you all.
Thank you, Dr.
Hello.
Rishabh.
Thank
you.
you.
Hello.
Yes.
Yeah, Dr. Amrita.
Hello.
Yes, Dr. Amrita, we can hear you.
Tomorrow's series is series number 3. Can we view series number 1 and 2 on YouTube?
I think you can view series number 2.
Okay.
Series number 1 we haven't uploaded. Maybe we'll share a drive also. We are planning, our team is just planning to put all the videos of fellows, also the expert series in a drive, and we will share the link with you. Similarly, the presentations also we are planning to put together in a drive, and we will share soon.
Okay.
Yeah.
Thank you.
Thank you, Balaji. So thank you.
Yeah. Thank you all.